Hi guys, and welcome to my vlog on skills versus capacities in the weight room. To start with, we will look at two athletes squatting and two athletes completing pull-ups, who will both present with limitations. One athlete will present primarily with a main skill limitation, where the second should be limited by a capacity. So looking into skills and capacities. A skill limitation can be improved with practice and often responds well to verbal cues to make the necessary changes to allow the athlete to move in a more efficient pattern. This in turn can be transferred to help enhance the athlete's performance. On the other hand, a capacity limitation is usually not helped with cues and drills, as there tends to be a musculoskeletal limitation driving the inefficient movement pattern. This could be an acute or chronic injury or limitation that can be improved, such as the athlete presenting with a reduced range of movement at a joint. However, this could be permanent. For example, if the athlete has had surgery to fuse their joints, and therefore this has become a permanent limitation. We're going to look at Seb completing a front squat. From behind, he presents with a good movement pattern, but from the side, it is easier to see that his movement is limited by a reduced skill level. When we go back from behind, we can see that he is actively pushing his knees outwards and that his right knee has a tendency to fall inwards at the bottom of his squat. Seb's movement is pretty symmetrical, and the addition of the line shows us how Seb's right knee has more change in direction than the left. As mentioned previously, Seb's skill level can be seen better from the side. In this position, we can see how Seb completes a third of his squat in a downwards movement with a high chest before he starts to move his glutes backwards. Seb stops squatting through his knees and starts to flex at the hips before continuing his squat to the bottom of his movement. At the bottom of his squat, Seb is balanced more towards the front of his foot with his chest lifted and knees in full flexion. In conclusion, Seb's limitation is his inefficient movement patterning. To try and improve the squat, Seb was given one cue. This was to drop his bottom directly downwards. From this one cue, we can see how there is an improvement with the direction of the squat, and this has allowed Seb to keep more of his body close to the centre line, which is being used to show roughly Seb's centre of mass. The second athlete squatting is James. James appears to present with a skill limitation. He has poor movement patterning with more of his weight transferring towards the right. When in a closed chain exercise, such as the Smith machine squat, James finds it easier to stay more central and to keep his chest up. When moving James to a front squat with a stick, his right knee falls further forwards than the left, and this leads to the appearance of right foot pronation and more internal rotation of the right hip. From the side, James has an increased amount of hip flexion and is not able to gain his full knee flexion. James actually has a capacity limitation of reduced left knee flexion. When kneeling, James is unable to sit on his feet. In some athletes, this could be because of tight quads, such as tightness in the rectus femoris. However, for James, this is actually a musculoskeletal problem. James has had multiple knee arthroscopies and is limited at 120 degrees of left knee flexion. With James holding on to an object to stop his chest falling forwards with excessive hip flexion, it's very obvious that James also has a poor movement pattern. He, like Seb, needs to drop his glutes directly downwards, and James also needs to allow his knees to travel forwards over his toes. However, this is a good video to show that James is unable to gain full knee flexion at the bottom of his squat. When we compare James and Seb's front squats, we can see that they are similarly lacking in skill with their direction of movement. With Seb being more experienced, the reduced faults would be expected. One main difference is that Seb's ability to gain full knee range of movement does not limit him at the bottom of the squat, and therefore this allows him to be more upright and balanced. However, James has to gain more compensatory patterns, such as through hip flexion, to maintain his balance. Now we're going to look at pull-ups. Pull-ups can be completed with 3 different grips. However, here we're going to look at the overhand and underhand grips. This is a video of myself completing a pull-up. When having a look, it appears that I have reasonable symmetry and good concentric control. Like the overhand grip, the underhand grip also has good symmetry. In both hand grips, the final eccentric control is not as strong as the concentric, and this does result in poor control when returning to the hand position. From the side views, I have a tendency to pull the bar in front of me. I then reach the top of the movement and flex my thoracic spine. This movement results in a swinging movement which can be seen more clearly in the undergrip. At the bottom of the pull-up, I have a tendency to just drop. I present with a skill limitation with a lack of latimus dorsal activation and body awareness of how to do this. By improving my knowledge of how to use my lats, this skill limitation could be limited. When we look closer at my pull-ups, you can see that I start my movement by internally rotating my shoulders. From this position, I use my biceps to pull myself up. This does show how my anterior chain is stronger than my posterior. From the side, we can see that I have a slight tendency to extend through my thoracic spine, and that is just showing how I'm really trying to recruit my pectoral muscles over my lats. For my pull-up to improve, it would be appropriate to use a cue such as give yourself a neck and then pull your elbows into your back jean pockets. This would not only promote posterior chain strengthening, but would also most likely reduce the feeling that I should overcorrect my posture at the top of the ascent of the pull-up. This would also help with maintaining a strong eccentric movement pattern with an increased skill level. The next athlete we will look at is John. John does struggle with pull-ups in both grips. Some would say that he struggles with his movement patterning because of his strength. However, he does have a capacity limitation. John completes his undergrip pull-up with a degree of left side neck flexion and right neck rotation. When in overgrip, his grip is much wider and John has a bias towards the right side with a greater shoulder elevation. When we add the line to the video, we can clearly see that John's right shoulder is elevated, and this in turn has resulted in his right elbow also appearing to be higher. This could be because of a weakness through the right shoulder and overuse of his trapezius muscles, or in this case, is likely to be because of a reduced range of movement through John's right shoulder. Here we can see that John has what appears to be an acceptable level of shoulder flexion. When he limits any possible lumbar and thoracic extension against the wall, John is just shy of 180 degrees of flexion. This may explain why John has a tendency to lose some control in his chest when we look side on. Here John is on an assisted pull-up machine, which removes not having enough strength as a capacity limitation. However, when we look at abduction in full shoulder flexion, John is limited through the right shoulder. This would explain why John struggles with a narrow grip. When putting John onto an assisted pull-up machine, John is able to reduce his skill limitation of not having enough strength to fulfill the full exercise. He is also able to have a wider grip, which does reduce the need for the full shoulder abduction. However, to be able to complete a pull-up to a high standard, John would need to not only increase his strength, but would also need to increase his shoulder range of movement. When comparing the pull-ups, one obvious difference is the grip width. John has a much wider grip. This is more beneficial for John because of his reduced shoulder abduction range of movement. It would also be more beneficial for my pull-up, as this would help me with increasing my skill acquisition. John's biggest limitation is his strength and not being strong enough to be able to complete the skill to the technical model. To conclude, a skill limitation can be improved with cues and would respond well to drills and further skill and strength-based exercises to improve the athlete's ability and understanding. A capacity limitation is when an athlete is limited by something such as range of movement at a joint, and this would then reduce their ability to complete a skill to the technical model. This vlog has shown both skill and capacity limitations that include poor movement patterning, insufficient strength, and limited joint range of movements.